Okay. Shall we let the participants in now?
Yeah, sure.
Please.
Okay, welcome dear participants.
Well, welcome all the participants to the session today. I'm Swati, your host for today, and we are starting in a minute or so. We really thank you for joining us on time, as time is the most precious thing that we have today. So we really appreciate you joining, and we are starting in a moment. We have the esteemed panel with us, and thank you for registering in numbers and joining us. We are also streaming live at Facebook and LinkedIn, and thank you for joining at those platforms also. So let me start officially the session 3 for engaging HCPs digitally and beyond. Well, as a platform, we keep doing a lot of sessions for the pharmaceutical industry, bringing in insights from pharma experts, from healthcare experts also, and from other experts, including management. So this one, in collaboration with Taylor and Francis Group, we wanted to add value to the lives of pharma management and pharma marketing people. And we hope we will be able to add such value towards the end of the session. Let's see what we have to, what we can hear from our esteemed panelists today. The topic for today is assisting healthcare professionals publishing their case study and create a global impact, Voices of Masters. This is the culminating session for this series. And earlier we did 2 more sessions which talked about the newer digital approaches for engaging HCPs, and also what products we have from Taylor and Francis Group to support the HCPs in their journey of publishing through open access digital platforms. I think this is the best time and the right time for this session, as most of the pharma companies are looking for creating their brand plans, how to engage the doctors, what all marketing material would go into making, and all those things. So why not hear from the masters themselves what they require, where pharma can support them in publishing, how they have supported till now, and after COVID, and after this digital thing has erupted into healthcare, what has changed? What more could be done? So first of all, let me thank Dr. Shashank Joshi, Dr. Archana and Singal, and Dr. Dinesh Pendharkar for joining us today on this forum. And thank Taylor and Francis Group, Sonali, Ruchi, and Pushkar from their side, who are instrumental in bringing the doctors today to this forum and generate insights. Over to you, Sonali, for introducing the speakers for today. Sonali, kindly unmute.
Sorry, I was somehow not getting the permission. Thank you. Thank you, Dr. Swati, for the warm welcome. Good evening, everyone. And thank you for joining us today in the 3rd session on the theme of engaging HCPs digitally and beyond for empowering pharma marketing and medical team. We have successfully conducted 2 sessions in this series, the background of which I will give shortly. Before that, let me just give a brief background about Taylor and Francis Group. Taylor and Francis Group is a part of Informa, who is a leading international intelligence, events, and scholarly research group. We are here to champion the specialist. Through hundreds of brands and a range of products and services, we connect businesses and professionals with the knowledge they need to learn more, know more, and do more. Informa is listed on London Stock Exchange and a member of FTSE 100. with over 10,000 colleagues working in more than 30 countries. Taylor and Francis is specialist in scholarly research and in helping academic and research communities making new breakthroughs. We commission, curate, produce, and publish scholarly research and reference-led content in specialized subject areas, helping to advance research and enabling knowledge to be discovered and shared. We partner with researchers, scholarly societies, universities, and libraries to bring knowledge to life. As one of the leading publishers of scholarly journals, ebooks, books, and reference works, our work spans areas of medicine, science and technologies, and humanities and social sciences. We publish more than 2,400 journals and over 5,000 new books each year, with a book backlist in excess of 120,000 specialist titles. As I mentioned in the starting, that we have successfully conducted 2 sessions in this series, wherein the first session was on newer digital approaches for engaging HCPs, where our speakers included Mr. Salil Kalyanpur, faculty at NMIMS, and Dr. Karthik Anantharaman, the Chief Operating Officer of Karnataka State Cluster with Roche Pharma, who highlighted the need for HCPs to create personal brand in digital world post-pandemic, and how pharma companies can play a bigger role by supporting the HCPs in creating their personal brand, that too digitally. While the second session was on digital innovation, supporting HCPs in their journey of publishing through open access digital platform, the session provided an overview about the open research publishing, which will help HCPs to publish fast, openly, and without any restrictions. We tried to showcase everything about digital publishing and innovative open research solution to support HCPs. Today is the third session, like Dr. Swati mentioned, on assisting HCPs publishing their case study and creating a global impact, Voices of Master. Today, our expert panel will share their experience of publishing their research, case reports, and how this will benefit overall medical fraternity. We will also talk about how pharma can play a vital role in accelerating this change by supporting HCP's publishing journey. So let's begin. Our panelists don't need an introduction, as they are renowned healthcare professionals and masters in their own therapy area. However, I will still give a brief introduction of them one by one. Firstly, we have Dr. Shashank Joshi with us. Dr. Joshi is the president of Indian Academy of Diabetes, past president of Endocrine Society of India, past president of Association of Physicians of India, and past president of Research Society for Study of Diabetes in India, chair IDF Southeast Asia. He's current the consultant endocrinologist at Leelavati and Bhatia Hospital and Joshi Clinic, active member of the COVID-19 Task Force of Maharashtra. He's a former faculty at Gran Medical College and Seth GS Medical College in medicine and endocrinology. Dr. Joshi is practicing endocrinologist and diabetologist who has topped all years of MBBS, MD, and DM with gold medals. He's a fellow of the American College of Endocrinology USA, American College of Physicians USA, and the fellow of the Royal College of Physicians, London, Glasgow, and Edinburgh. He has more than 800 research publications to his credit. He is the honorary emeritus editor of JAPI, which is the Journal of the Association of Physicians of India, ex-editor of Indian Journal of Obesity, Indian Journal of Endocrinology and Metabolism, and Indian Journal of Clinical Pharmacology and Therapeutics, and several other leading medical journals. He is a visiting faculty to several Indian and international universities. He's actively involved with evidence-based work in endocrinology, including diabetes, obesity, thyroid, osteoporosis, and growth. He was awarded International Clinician of the Year 2012 by the American College of Endocrinology. He has been conferred in 2014 Padma Shri by Government of India. Dr. Shashank, I welcome you to this session and thank you for joining us today. We also have Dr. Dinesh Pendharkar with us. Dr. Pendharkar is presently the director at Sarvodaya Cancer Institute, Faridabad, board member of Acharya Harihar Postgraduate Cancer Research Institute, Cuttack, mentor District Cancer Care Program, MP, Chhattisgarh, Odisha, Himachal, and consultant National Cancer Center, Tashkent, Uzbekistan. He has also been the past chairman of International Affairs Committee, American Society of Clinical Oncology, past president of Indian Society of Oncology, and past president of Indian Society of Medical Oncology. I welcome you, sir, to this session.
Thank you.
Thank you for joining us today, sir. And we also have Dr. Archana Singal with us. Dr. Singal is very renowned dermatologist from Delhi. She's currently working as a director professor and head in the Department of Dermatology and STD, University College of Medical Sciences. She is an alumnus of Medical College Rohtak, Haryana. For both her MBBS and MD, DVL, she has over 30 years of post-MD experience and has been a teaching faculty for 25 years and recognized supervisor for MD and PhD. Her chief areas of interest include tropical dermatology, nail disorders, and genodermatosis. She has published extensively and has to her credit over 250 scientific publications and 45 chapters in different standard textbooks. She's the chief editor for the books Comprehensive Approach to Infections in Dermatology, Comprehensive Approach to Nail Disorders, Atlas of Infection in Dermatology, and Superficial Dermatophytosis. She's associate section editor for British Journal of Dermatology and editorial elect for IJDVL. She's recipient of many awards and orations and is a regular invited speaker at national and international conferences. At present, she's also the head of dermatology, Faculty of Medical Sciences, University of Delhi. Ma'am, I welcome you to this session and thank you so much for your valuable time.
Thank you, Sonali. Happy to be here.
Thank you. We also have team of Taylor and Francis here. Ms. Ruchi Chauhan, Head of Marketing, Mr. Pushkar Singh Raghuvanshi, Business Manager, Pharma, and myself, Sonali Bhardwaj, Senior Marketing Manager. Firstly, I would like to thank our panelists for taking out time from their busy schedule and be here with us. The pandemic has taught us the importance of evidence-based research, which is the need of our in clinical decision-making. This can only happen through continuous research and proper documentation through quality publication. As we all know, HCPs spend maximum time in clinical practice. And before this session, Dr. Archana and I was just talking about this particular topic only. And also there's a lack of training about publishing research, formatting manuscript, plagiarism, and in case the research get published, how to gather more eyeballs so that it can make real world impact. It becomes very challenging for them to contribute to medical research significantly. Thus, pharma can enable HCPs in addressing some of the above challenges faced by busy clinicians in their publishing journey, like providing training to doctors, making their research more impactful. In the same context, I would like to ask my first question to Dr. Archana. Ma'am, would you like to share your past publication experience and challenges associated with it?
Thank you. So I started publishing right after, even during my post-graduation. Those were the tough times. So everybody, I think Dr. Joshi and Dr. Dinesh would agree that, writing was very difficult because we did not have access to computer, internet. Getting references from the journals, cross-referencing was very difficult. It was a Herculean task to get one article published. And, being in Delhi, I would station myself at the National Medical Library and, we will have 20 journals and, write everything by hand and then get it typed, post it. And, the expenditure had to be borne by the person who is writing the article. and then either it will get rejected or it will come back for revisions, and then you make revisions again. So that was a very difficult journey, but at the end of it, getting your article published and when the journal will be received, it was very, very gratifying experience. Absolutely wonderful experience. And then you get hooked, once you publish few journals in good, few articles in few journals, and then you get hooked. It becomes a habit and very difficult to get rid of. Of course, there are challenges to, publish in good high impact journal. And then for 31 years, I'm stationed at UCMS, where the publication and the academics are very much valued, and we do have academic freedom. And then you develop your areas of interest. And when the article, even when the article used to come back with the comments, I used to take it, in a very positive manner. Earlier, I used to feel very disheartened, but then I used to take it in a very positive manner, that the reviewers' comments will help improvising my article. So that was taught to me by my HOD. And I used to review a lot of articles for him. So, and reading journal, once you are, hooked to reading journals, you automatically turn a writer, and then you start making a note, and, in every simple case, what is different from the existing one. And then you keep writing and getting accepted, one article, two article, and then, it becomes a very, very gratifying job to publish. And then you have your postgraduate students, who get trained under you, and rest is history. So, and in fact, being on the reviewer board and editorial board of many national and international journals also help, because you see the reviewers' comments from everyone. So it's just that, you don't think that, very first article will be published in a British Journal of Dermatology or Journal of American Academy of Dermatology. It's a very slow process, but at the end of it, it is a very rewarding process.
Very well said, ma'am. It certainly feels really great when the first article has been published, and then you actually get stick to it, that you have to publish more. Okay, let's write more, let's publish. Very well said, ma'am. Related to that, my next question is to Dr. Shashank. Sir, research shows that India contributes 2% of global medical research output, which is significantly less looking at the research potential we have. So what do you feel are the barriers limiting HCPs in contributing their research?
So first of all, thank you, Taylor and Francis and Sonali, you in particular, for having all of us and having medical doctors or healthcare professionals on board. You ask a very pertinent question that only 2% of global research output comes from India. And out of that 2%, more than 95% comes from research academia, like institutions like the one which Dr. Archana belongs. So that's really not a good thing. But let us look and do some background, deep dive in this. Now, to do research, you need records. Okay. And you need excellent record keeping. Now, there are two global worlds in healthcare service delivery. One is the reimbursed world. The reimbursed world, which is north of America, in Europe, and some parts of Asia, some parts of rest of the world. Record keeping is mandatory because there is a third-party insurance provider which mandates medical record keeping. It could be done physically or digitally. That's prima sin. So that's the primary thing. So if you go to health records, if you go to United States, UK, Europe, more than 98% of what is seen by a doctor is recorded, collated, and kept into a data repository. Now let us look and come back to India. India has a major healthcare delivery happening in private sector, 70% to 80%. It was actually much more. And then coming through the public health sector, which is also very large. How much of that record is recorded and kept? You'll be surprised to know that it is currently only 3.2%, which means every interaction interaction of a medical doctor or a healthcare professional with the patient, the total data is collated and collected only by around 3% of what is seen in the healthcare service delivery model. Most of this data is collated in the hospitalized sector. So in office practice or outpatient services or clinic delivery models, the data keeping is poor. Unless and until there is a research study being designed or there is a research trial which is ongoing in the private or public sector, rarely the record keeping is complete and comprehensive. So that's the second challenge. So if we don't record what we see, how will we prospectively do some research? So that's our first problem. Second is the intent and the culture. So a couple of us are in whatever sector we may be, academic or private sector, we have a research intent, educational intent, teaching intent, and generation of evidence. But we don't have the publish and perish culture, which is now gradually creeping in the academic medical world of India for promotions, for being high up on the pecking order. For example, when you see and cite a researcher, we don't look at the H index of the researcher, or we don't look at the amount of research output the researcher or the education has done. So this is the other challenge. The third thing is the most of the busy doctors do not have the time or the intent or the ability to document and then put it out in a research way, both retrospectively and prospectively. See, both type of research exists. So we have that big lack now. And ultimately, our research funding comes from, unlike NIH in the US or a lot of other global agencies, we have ICMR, we have CSIR, and very few private sector NGOs which fund medical research. Pharmaceutical industry funds research predominantly only in the regulatory space. Outside of the regulatory space, investigator-initiated protocols are very scant and few. If you go the same in the United States or Europe, you can have an idea from Dr. Dinesh or Dr. Archana. If they have an idea and they discuss it, and their student can write up a proposal to the government or to a pharmaceutical house, they can get fully funded for that research idea to be translated into a pilot, and the pilot can be scaled into a full-fledged research question which can be answered through a clinical trial or a evidence-based mechanism. That's not happening. So we really need to sensitize a generation of Indian evidence. COVID was an excellent opportunity. COVID originated from China, but later on spread across the world. India had a large database. I'm sitting on a repository of huge database. But our research output has been abysmally poor because we are so caught up into our day-to-day clinical care. After clinical care, if you're in academia, you're doing educational bit. And that has also taken a backseat in COVID care. And after education, then comes the research output. So it's very, very important to recognize that from record keeping to research grants and money to research initiation and sensitization to a passion and zeal to publish. You see, we need both private and public sector to actively engage to ensure that we contribute evidence. And I think COVID gave us an opportunity, but we were overwhelmed with work. But as COVID now gets on the wane, and we have now, 5 to 10 years of post-COVID or during COVID or living with COVID era, we will see a tsunami of a lot of non-communicable diseases coming up. We have an opportunity because COVID has digitalized health to a great extent. And some degree of record keeping has come in because of digitalization. But remember that we need to have in India a uniform health record, a digital health record, and a digital repository. We have an Aadhaar card now. We have a CoWIN app. We are in digital India. But it's important that we have a unified digital health record like they have in the United States or United Kingdom. Only then that would be the starting point to really start up on the medical component of research. As far as the non-medical side is concerned, originality of thought, generation of research ideas, we also need both the research industry, which is pharmaceuticals, governmental agencies, to increase their spend on R&D for India to generate Indian revenues. That also is abysmally poor. You see, our percentage of GDP for allocation for health is very poor. You know, it's only maybe 1% or 2%. So obviously, it's a very small percentage which we are spending, and we definitely need to increase that. And lastly, you know, because I was coming on this show, I asked I have a lot of fellows in my hospital which I go, Lilavati, and I asked them, why you people don't want to research? Well, sir, it's very expensive. You know, full text journals are not easily available. And if I have to publish in a journal, then I have to pay a lot of money. And I don't have that type of money. And, you know, and also the acceptance rates are very poor. And they are not sensitized and trained in research output. So, you know, there are multiple factors which are there. I hope I have given you some answers and insights, because it's a it's a debate by itself, why research output in India is less. But I think it's getting much better in the last decade compared to the past. And it's important that we engage all stakeholders. But I think the first drawing board is to generate good health records. Because if we record, we can then have ideas on which we can research. But if we just don't have records, then it's very difficult to generate some good science.
True, sir. Very, very well said, sir. And you have perfectly answered my question, because you have perfectly defined all the challenges that a particular, whether a young doctor or whether an established doctor come across while writing or publishing a research. Thank you so much for that, sir. My next question is to Dr. Dinesh. Sir, do you think open access publishing will help Indian doctor to publish local case report, which can create a global impact? So you're on mute. No, sir, it's still doctors. Yes,
it's
sir.
okay.
Yes, sir.
So Dr. Shashank has very clearly said that the problem is with the access. Today, if I want to publish an article somewhere, the first thing they ask is upload the money. So if for a researcher, it's not easy to upload the money. Even if you have the money, the cards doesn't work. There are a lot of challenges. So it's not only open access in terms of just publication, but open access financially, it should be. So that I am able to publish the data or a paper without getting in, but I should have an access, that open access, number one, but it should not be taxed to finance. If it is not taxed to finance, then we would be probably seeing more research from our juniors, from the people who are doing PhDs, for our DNBs and MDs. So I think in a lot of our countries, if you want to do a research, for example, if you're doing an MD, or if you're doing a post-graduation in US, America, Germany, you have to publish a research. And unless you publish, your thesis is not accepted. So all MDs and MS students in India do MD, MS thesis. So we should come up with some regulation that they should publish. So we seeing the difficulties in publication, we can challenge it saying that, okay, just publish it as an abstract, or publish it in open access. And maybe we can create some open access in India through ICMR or somebody, where these people will have a really free access to publish, especially postgraduates, because these are the people who are doing they are regularly doing some research, but they are doing today just to fulfill the requirement of writing a thesis. It will become more probably important if it gets published, and if they get a valuation for it for their next level of employment or a training. So I agree that open access is extremely important, should be available to us, and that would really help us. Thank you.
Thank you, sir. I truly agree that open access is something that really good for anyone to access the article. I completely agree. Thank you, sir. On the same note, Dr. Shashank, my next question to you, which is, do you think if we have more and more Indian case reports and research articles published, it will help the medical fraternity to take better clinical decisions.
Oh, absolutely. I think, we are here to listen. What we listen, we learn.
Yeah.
What we learn, we adapt. But, we are very good at anecdotal medicine and experience-based medicine. Unfortunately, in India, that's the trend and the norm at the top. But what we see as anecdotes, what we see as interesting clinical observations, what we see as prospective observations, what we collate, what we saw in the retrospective organization, if you put them in a structure and a format and put them into public domain, it will not only aid the researcher for giving him a tick mark on the research project and the research team, but I think it will be a service to the nation and the service to the world, because we are in a global village and every case matters. So case reports actually are the most difficult to publish, if you ask me, because you see everybody sees a unique case and everybody thinks that I'm the first one to see this unique case, and therefore it's impossible to get a case report. And because the journals are so wedded to their impact factors, and if you publish case reports, the impact factor is very low. So obviously now there are separate dedicated journals of case reports. Case report doesn't come up very high on the pecking order of hierarchy of publications. But case reports are having two important contributions. Number one, it teaches clinical medicine. At the end of the day, whether it is Dr. Dinesh or Dr. Archana or Shashank, we are all clinicians at first. For us, our patient is our God. And for us, every patient matters. Every person with a disease matters. So a unique case report, which is truly novel, truly recognizable, is very, very important for the world to know. So it's not only a insight, but also it's a very good teaching tool for students and for clinicians both. You see, we are as doctors, we are lifelong learners. So obviously we need to understand that. For example, I will give you a simple example. We are in COVID times, okay? And in COVID times, we are having this long COVID syndrome where people are losing memory, okay? And we can correlate it. It could be linked to a simple high TSH. It could be linked to a B12 and D3 deficiency. But we need to correlate, publish, make the case report, make a case control study, publish that data on board. So it's important to recognize that. This is a simple thing. Post-Omicron, it's a mild disease. It's a nose and throat COVID, and we are seeing a lot of long COVID now. And we are seeing a lot of forgetfulness. So it's a simple thing. It's a simple observation, and it could also have a simple intervention, well designed, and can be well thought, because it can have an impact onto day-to-day management. So I think it makes a difference. We saw this in COVID, that everything in COVID was unpredictable. But now we have a pattern. See, now we know the pattern. In the first wave, we didn't know what we were dealing with. In the second wave, we knew clearly that there is a desaturation, there's oxygen, there's steroid which works. In the third wave, we knew it was a nose and throat COVID, lungs were not affected. We are good to go. It was just a little modified flu-like syndrome, but it has an aftermath of thrombotic complications, not well reported, which is now work in progress, and of a long COVID syndrome. So, it's important, Sonali. I'm giving you illustrations of COVID because COVID is fresh in everybody's mind. Okay, but it's important to recognize that case reports or research reports are contributing to science, contributing to clinical medicine, contributing to clinical teaching, and contributing to profession at large to become better doctors. I think that's very important. Young or old, doesn't matter. We are all students. I'm sure, every day, Dr. Archana or Dr. Pendharkar see patients. I see patients every day which teach me. Yeah. But if they have taught me something new, I would like to share it. So sharing have platforms. Research platform is a global platform in a global village where I can share it. So I think we need a space for that. That space is very cluttered. And therefore, we have very unique students, and also case reports become the initiation points of inducting a young medico into research world. I started my career as a medical student by writing case reports, and now I'm designing trials. So it's a journey over the last 30 years, which I have seen. So similarly, Case reports are a very good initiation point. So I think case reports are important, but they are not very high up on the pecking order. Research reports are equally important. Originality of thought is very, very important. We must do good original work. And you see what China has done, what Korea has done. If you look at Asian countries, their research output is very huge, but they give incentives. As Dr. Dinesh said, we need governments and our academic institutions to give incentives to publish. Finance should be not be a barrier. If you have a research idea, you have a research interest, if you write a good paper, there should be a mechanism through which either the pharmaceutical industry or the government or a research agency can support that paper to see the light of the day. And that mechanism or vehicle can be created.
True, so in fact, very well summarized in just few words that I truly agree that novel cases is a very good teaching tool, and cases do contribute to the, I truly agree with you, sir. So I think related to that, like you just mentioned, that pharma can also support this. My next question is to Dr. Dinesh. Sir, how do you think pharma companies can work with HCPs to turn this challenge into an opportunity of publishing the evidence-based research? Dr. Dinesh, can you hear me? Sir has lost the network.
Yeah, there is some network error.
Yeah, maybe. Yeah.
Here,
Probably.
something.
Frozen problem. This is two challenges of Zoom meetings.
Yeah, technical glitch, sir. So
He's joining.
He's here.
here.
He's here.
Dr. Dinesh, can you hear me?
I don't know why. Okay, go ahead.
Sir, shall I repeat the question for you, sir?
Please, please, please.
Okay. So on the terms that we are talking about, the financial problem and, probably the teaching and, the other support that is required. So do you think that pharma companies can work with HCPs to turn this challenge into an opportunity of publishing evidence-based research?
I think it's very easy. It can be easily done. And pharma companies can play a very, very big role. For example, I just say, if I have a case study with me and I have to write, what is the challenge? I am not a writer and I cannot write. So you know that there is a specialty called writers. So I personally feel one pharma industry should take care of, say, one hospital or department, attach one or two writers to that hospital. So see, in any case, pharma can afford to do it with their CSR. So if there is a writer, one or two available in a hospital, a person who has a case study to write, he can say that he can fill up some form, make some data, get that thing to that person and say, look, I want to write this story. And then this writer helps him writing it. I think just this small addition of a writer to a hospital through a pharma industry can actually revolutionize the writing thing. I don't write because I can't write and I need assistance. So if this small thing can be done, I think we would do wonders, because there are, in any institution, there are at least few people who are willing to write and who have a data to write. And through CSR, this can be very, very easily done, addition of writers. Thank you very much.
Right, sir. Certainly pharma can support in writing assistance, but I think the point was also about, which has been discussed in just now, was also when it comes to publishing, there's high APC. So do you think that pharma can also support that part in, getting the research published?
So see, if the finance is involved, I don't think pharma should come here to pay the money for the publication. No, I would rather say that pharma should create a platform. So maybe few pharma can put some fund, create a journal using the leading editors of all journals of India, create one open access journal, give a website, make an open access internet-based journal, and then allow people to publish there. Just here, it would require just creating a space and some technology backup, which would be much easier. And then it should not ask for the money. So instead of paying for every publication and article, if we create this cloud space with a cloud journal which belongs to the country and where a country can publish, I think it can be very easily done and not through direct financing. Thank you.
Right, so probably an open access platform would probably work, right? And my last question is to Dr. Archana, after which we'll open the floor for question. Ma'am, we have had some really interesting discussion about the importance of publishing case reports and other content in an open access platform, which Sir also just mentioned. We have a lot of medical conferences happening, and you have been invited as the speaker at a lot of national and international level conferences, so as Dr. Joshi and Dr. Pendharkar, wherein clinicians present posters, presentations, data notes, and a lot of other type of documents, which usually either doesn't get published online or tends to get lost. So do you think it's a good idea to publish these content in an open access journal so that others can get benefit from it?
Yeah, so many of us we give, because all these conferences have limitation of time, so everyone cannot speak. So there comes the role of posters, and some of the posters have very good studies, case reports. As I said, we are in India, the sheer number of patients gives us an opportunity to have large clinical database, which doesn't always get extrapolated. So in addition to Dr. Pandekar's view of open access, I will also suggest one more thing where pharma can help before I go to the second question, that you can help sometime get the patient investigated in a proper manner, because our clinical acumen is great, but sometimes we do need help. We do need some laboratory support or investigations, which comes with cost, and it is not available in most of the private hospitals or in government run hospital. So there can also come the role of pharma support or CSR. Coming to the abstract publication of the abstracts and posters and all, it's a great idea, because some of the societies, the dermatology society doesn't publish, but my husband is a gastroenterologist, and after the annual conference they have a journal which publish all the abstracts. Okay, but for a detailed one, there can be an open access journal pertaining to every specialty, and after the one of the annual conferences, all the abstracts and posters and case reports can go to that open access journals. But then one has to be very sure of, we are talking about open access journal, but we should also be aware of predatory journals and dubious publishers who solicit a lot of authors and they charge heftily, but the research they publish or the case report they publish do not see either or get high impact, or dissemination, it's not widely disseminated. So one should be aware of predatory journal, and I agree with Dr. Pandekar, there can be a common space, open access space for every specialty where all these data can go.
Thank you so much, ma'am. Very well said. And I would now like to thank the panelists for the wonderful discussion and their valuable answers. I'm sure each one of us would have some key takeaways from the discussion. And personally, I had a lot of takeaways starting from, learning from experience and keep on writing, and the record keeping, the importance of data keeping, and the percentage that Dr. Shashank told about, that only 3% in India is where the data is kept recorded, and then mentioning about all the challenges that we have and suggesting about how pharma can support. I think the discussion was really great, and I really want to continue this discussion, but looking at the time constraint, and we already have a lot of questions. So I think we'll now begin with the question and answer session. And I am sure that all our participants have a lot of questions for our panelists. Therefore, I request you to please type them into your chat box, and I'll try to bring them up one by one. So our first question is, like in UK pharmaceutical market, PMCPA is a body which regulates all the cases of pharmaceutical companies breaching code and other code of conduct legal issues. Does India should also create a body which can regulate and provide platform to launch the clinical paper or case report? which will be authentic as well as coming from a well-reputed platform. Pharma companies can partner along with the government to develop the same. Anyone can answer.
So there is no regulation on in India currently on medical journals or healthcare publications. So it's a need of the hour, but there should not also be over-regulation. So I think most of the regulatory publication-related data is in the public domain, global data. But the point is, there was a mention by one of the speakers on predatory journals, which has sprung up very big. And there has been also an obsession on PubMed index journals. You see, this open access actually has beaten all this. Formerly, it was all Medline, then PubMed Central, then came Scopus, and all this became very restrictive. So it's ultimately boiling down to a blog and a Google and a WhatsApp, but it's not peer review. So there is definitely a need for a collaborative regulation. There's no question asked about it, but it has to be well structured and well geared. It should not become draconian and dictatorial, which is a fear which people have. So there has to be a tightrope balance when you are taking and talking of a unmet need of a regulatory necessity. That will only come if it is mandatory. See, currently you said research output is so poor, and it is not mandatory. I mean, it's only now getting a little. It gives you an additional consideration for a promotion in academia. Beyond that, is there anywhere else it is mandatory to have a research paper on board? No. So once that becomes mandatory and the publication output improves, then the regulation will come in. So once our research output goes to a critical mass, and once we get very good record keeping, and we are able to have a record depository of records, we will be able to get there. Also, I feel that once the private insurance companies underwrite both hospitalizations, not just for critical diseases, but general hospitalizations, as well as they underwrite office practices, not just in private space, but also in public space. And data management becomes mandatory. I'll give you an example. If you have, we already have an employee state insurance scheme, which is an ESIS under Department of Labor. It's like a Medicaid, Medicare across in the US. But we don't have digital repository of that whole healthcare domain. Except for medical colleges, if you go to a primary healthcare center or a district hospital, do we have their records maintained? No. So if you really want to build a research backbone, you need to build a digital record backbone or a physical record backbone, and then move forward. So I think it's work in progress. And then only once the research output goes up, you will get a regulation in place. Right now, I think we still have issues related to confidentiality, issues related to digital reluctance. People are not willing to move on to digital. Even now, patients want to see me physically. They don't want to see me digitally. You see, telemedicine took a big jump in COVID times, and specialties like endocrinology or dermatology did have a lot of digital interaction. But now the pandemic is gone. Everybody wants to see you physically. Cancer care on the other side still continued. Critical care, cancer care, coronary care, obstetric care, trauma, all that continued. But our spaces, we had some digital. So I think we'll have to move to hybrid models. But regulation, I think we are still a little away from that prime time.
Right, sir. Dr. Archana,
I think I will also like to add that open access is not magic, it will not, it has to have a quality. So peer review is the key to have some quality. It's not that every article that is submitted is worth publishing. And so I feel like even for, I'm an editor and I see the quality of the papers submitted. So maybe it adds to your clinical acumen, but unless and until it's adequately worked up, adequately documented, again, then record keeping is the key and peer review is the key. Otherwise, this open access space will get polluted very soon.
Right. True.
And it's the quality, it's the quantity also that matters. Of course, we talk about quantity, but then quality also does matter, especially in medical practice.
That's true. Thank you for this, ma'am. And the next question is, do you feel that there should be more educational programs for HCPs to train them in managing quality data, ethics, writing, or publishing their evidence-based research, which can be enabled by pharma?
Yes, I think this is need of the day. And what I personally feel that it should be a part of MD, MS, DNB program, that when students join MD, MS, DNB program, their first month or second month, we should have 2 days, 3 days workshop, teaching them how to review the data, how to analyze the data, how to publish the data, and how to make presentations. We do get some teaching somewhere in some conferences, but if it comes as a program, if DNB or MD says that every institution should definitely organize 2-3 days seminar for PGs who have just entered, not at the fag end of 3 years, I think this could help them in at least thinking about what they are supposed to do in the next 3 years. Thank you.
Dr. Pandekar, for your kind information, sir, there is a curriculum like this for postgraduate thesis. Now we have 4 days of workshop from morning till night in different batches before the protocol is submitted, and then there is another one for 4 days before the final results are submitted. So it's now part of the curriculum, and medical education unit is now a must-have unit in every medical college, and so this is being done.
That's great to hear, ma'am. Thank you. The next question is, does impact factor is really important factor for deciding publishing?
I think it is. I think you need.
To me, it matters.
Everybody, it matters. I think it's. See, there are 3 things. One is that impact factor clearly has the edge, in publication world. Okay. And impact factor above 8 or 10 is what people look for. So if you want to really be in a publication zone and you want to publish, you like to publish in Lancet or a New England Journal of Medicine or a JAMA, rather than getting into a just a Me Too publication. So that's the first thing. I think any impact factor below 5 really doesn't matter. Then just an index journal, so it really doesn't matter. So it's just there on a PubMed space. So that's the second thing. Secondly, beyond impact factor, when you go to the lower end or the fulcrum, then indexing matters. So at least it should be on PubMed. I mean, I would not see a publication which is not on PubMed. I'm very clear about it. If it is on a low impact journal, it may still be an observation, and getting into a high impact journal is tough at times. And there are many compulsions, including the turnaround time, the acceptance rate for a researcher when he's putting into different journals, and also access, and also a little bit of luck, because you see, it depends on the research priority for the journal and the research priority of the author. If they match, you could be lucky. So I got some of my early Lancet publications just by sheer luck, because they had a need and I had something in place. So maybe it was just simple luck. So it's also important to recognize that you need to cash in the opportunity which is presented to you and need to be smart. But
and
my
that's why,
advice,
sir, publish and perish also works even now, sir.
Absolutely. I completely agree with you. And the last thing which I want to say is that always aim high. So I always send, simple observations also to the highest impact factor journals. Even if they get rejected within a couple of weeks, the inputs you get are very excellent. And some of the reviewers really spend a lot of time.
Yeah, that's what I told in my this thing, that I always see the constructive criticisms given by the reviewers to improvise.
Yeah, I think it's worth it. So I think impact factor does matter. And a high impact factor definitely matters. Now remember, the highest impact actually comes for reviews.
Yes.
Okay, so a well collated review, but reviews are only written by people who have at least got some credible 2 or 3 original publications in that space. So then they claim to be domain experts in that space.
And
then only
I think it should not it cannot come very early in your career. One need
Sure.
to wait, be patient to get review or your research published. That's why I always say focus on few areas. If you want to be master of each and everything, like being a dermatologist, it's considered a small specialty, but it has at least 15 to 20 subspecialty. And focus on small areas, build on your experience, and then keep publishing in that area. You will get articles to review. Even reviewing an article make you wiser when you are reviewing few articles, well written articles.
Very, very well said, ma'am, and Dr. Joshi. I think on that note, we have our next question, which is, what's your opinion on transparent peer review process? Does it reduce the editorial bias?
There is sometimes bias, but maybe 20% or 15 to 20%. You see, especially in American Academy journals, that's what I feel like. I have had some incidences, but then if you're good, I think it will get published in some high impact journal. But peer review definitely adds to the quality of your journal, your publication.
Ma'am, I have a question, dear Dr. Panel.
Yeah, 1 minute.
Please.
Transparency has its pros and cons. So sometimes it's good to have that peer review process transparent. It allows you a lot of insights. Sometimes it could also be detrimental. I know a peer review process, not related to me, but another research group very closely is working with me. They saw the whole review and the critique, and yet the journal accepted it. And the group felt that there was an editorial bias, despite of referee objecting that a paper should go through. They actually withdrew the paper. So sometimes over transparency doesn't work, but that is research integrity of that research group. So it doesn't happen very easily. But I think transparency, bias, prejudice, our discussion matters and ethics is a completely different ballgame. And I think we cannot discuss it here. But it's important because in research and in medical publication, it does impact and it does matter. Sorry, Swati was saying something.
No, Dr. Shashank. Wonderfully you explained. I was just taking you back to your college days, dear doctors. So I was just thinking when we were studying, we were graduating, we had no touch points where we were taught about doing research or something like that. So what are your suggestions? What are your thoughts on this, that this curriculum should include something related to publishing, researching things, in a proper manner, in a way which could be taught in the graduation days only?
Swati, you're absolutely right. In fact, we used to have essays in schools.
Yes, sir.
So the medical essays in first, second, third, and fourth year medical students should actually be writing research papers. And ICMR has scholarships for these medical students, and they should at least have one PubMed index journal by the time they graduate. If you put some of these limits that if you want to be an MBBS doctor, at least you should have one paper, okay, in a reasonable journal. If you put it like a mandate, it actually will improve the research culture. Yeah, and and it will improve that. But if you make it mandatory, it will become more of a formality. It's like thesis.
Agreed.
So we do have, Swati, we do have students who, undergrad students who take STS projects with ICMR, and they do get published in ICMR journal, at least, if not in some very high impact journal. And I recently had a postgraduate student who had 5 publications before she came to join as MD. So there are opportunities, and you need student to cash on, basically. And they have their even when I was doing my post graduation, we had undergrad conference, national conference. So they do happen, and people are writing.
So most of the students who write papers are the ones who
go abroad.
Yeah, that is what I was saying, Dr.
So I have a student from KEM who used to work in my clinic, Sumit Hoskote. He's a very bright student. He used to probably remove a research manuscript every week. He now is a consultant at a very young age, in a span of less than 10 years, at the Mayo Clinic in Rochester, Minnesota, in pulmonary and critical care medicine. So if somebody has an intent
Yes.
Vigilance can write it overnight. And he had that zest and zeal because he wanted to be at the best place. So if that is there, but point is that they don't want to be here in the filter. They want to go there in that filter.
So
And
that's why they need this. That's why they need publication.
That is what.
So that's why they
awareness,
decide very early in their life, that they want to go abroad. And then they'll be after your life, they know who consultant in which department is publishing. And they want you to give some review and they will write it and they'll get it published. So.
Right, but pharma can really do a lot of support, can give a lot of support to HCPs in publishing their journey even at a young age if they can involve them at the clinical practice stage, and even if the peer reviewers are there, pharma can involve them. There are ways to do it. So, dear pharma professionals, you are seeing this discussion happening. You have got the insights, very, very good insights that Dr. Shashank, Dr. Archana, and Dr. Dinesh has given today. You need to work upon
you can provide some the articles which they need, because I may have access to some journals but they don't have as students, so that can be done. Like you can have, I think some of the pharmaceutical company I know, they provide the articles to write a review. So you give a list of them and they'll supply it within because they have access to the high impact journals, so that can be done.
Right, Dr. Archana, and Taylor and Francis Group with its F1000 platform, I think, Dr. Sonali. So please tell us about that also, so that pharma is aware.
Sure. Pushkar, do you want to pitch in now? Pushkar, are you there?
Thank you, Dr. Shashank.
Okay, no problem. So I think
yes, I'm there.
Yes.
So F1000 is an open access platform. It's a peer review platform. It's a multidisciplinary platform which accepts articles from most of the disciplines. It includes article either even from medical also, engineering background and other backgrounds. And it supports open peer review as well as peer review process. And yes, it also accepts article in various categories, starting from case reports, review articles, publications, consensus, and others type of article as well. Thank you.
Thank you, Pushkar.
So that can be a good platform for the beginners and even for the established ones.
Yes, and there are, and in fact, when Dr. Pendharkar spoke about having the open access platform, which can be funded by any pharma company, and the doctors can actually go in and publish, and they don't have to look for the money there. That is where this platform actually fits very well. And of course, this discussion can go long, but I think we are just we have reached the time limit for this session, and I personally really don't want to end the session, but the time, constraint that we have. And so I would like to thank our panelists, the entire panel, Dr. Joshi, Dr. Singal, and Dr. Pendharkar for sharing their experience of publishing, telling us about the challenges that an HCP face while writing or probably publishing or creating impact of their evidence-based research. And I would like to inform everyone that this is not the last session of the series. We will still, we will come back with more sessions related to this to have the impact. But if you would like to connect with us for any of the service or anything, the services are available on the portal where you have registered. And in case you would like to, Dr. Shashank has already shared his contact details. I will also share my contact details. So in case you would like to connect to us for anything, we would be really happy to support you there. And before we wrap up, I would just like to thank our panelists for their time and viewpoints, and also special thanks to Pharma State Academy for co-organizing this very important series with us. And thank you, Dr. Swati and Dr. Satish, for your support.
Thank you, Dr. Sonali, and dear doctors, thank you for your time and real insights. We all are here to create value in healthcare, and pharma and HCPs, they have to work together on many issues, not only this one, for creating a better healthcare facility for everyone involved, including patients. They are the major stakeholders. As Dr. Shashank put, patient is the god for a clinician. So you also have, pharma also has to see that viewpoint and act accordingly, create those collaborations where a better outcome is reached in healthcare. That is what we all aim here. So this is all from our side. Thank you, Dr. Shashank. Thank you, Dr. Archana, and thank you, Dr. Dinesh. Thank you, Taylor and Francis, for hosting this series along with us. Thank you, Sonali, Ruchi, and Pushkar from Team Taylor and Francis. And most of all, thank you, our viewers, audience, dear pharma leaders and marketeers who are listening to us and getting these insights. We really hope these insights are getting into the implementation mode. Thank you, sir.
Thank you very much.
Thank you.
Thank you.
Bye-bye. Thank you, Swati. Thank you, Swati. Thank you,
Thank you, Sonali and Swati.
Archana, Dinesh, nice
Bye.
meeting you. Bye.
Thank you.
Thank you, sir.
Thank
Bye.
you so much. Thank you, dear participants. Thank you, Dr. Archana, for joining us. We are ending the session now.